Good afternoon. We will start our pep talk now. It's already 2 o'clock. So, welcome all. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of your companions who are also attending and watching the pep talk. Use the chat box to ask questions and make comments while the pep talk is on. There'll be a group pictures at the start and end of the pep talk, so please show your face in the video. As a reminder, please take the online Learning Cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown below. Okay. I have placed the link in the chat box and also in the Facebook page and also in the Viber group. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now and show your face. Okay. 1. Ready? 1, 2, 3. Page 2. Ready? 1, 2. Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. What I have in mind in my pep talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. I launched this pep talk on May 15, 2021 with a module on COVID-19. The second module was on patient empowerment. The third module, patient management process. The fourth module on rights in patient empowerment. We're now on our fifth module, staying healthy and contented. There are 5 parts to this module: introduction and intentional living plan, healthy lifestyle plan, which we took up last week, screening and periodic health check, early diagnosis and treatment, first aid, and basic medical care. So my pep talk today is entitled Staying Healthy and Contented, specifically on screening and periodic health check. The empowerment objective is for lay people to have an understanding of the use of screening and periodic health check as a strategy in staying healthy and contented. We have heard of various terms such as executive checkups, annual physical examinations, screening, surveillance, periodic health exam, periodic health check, etc. All of them have one thing in common in terms of purpose. That is, looking for a disease that may be present in apparently healthy and asymptomatic persons. Let me try to dissect and collate the various terms. Screening is the most encompassing term that signifies an action to try to detect potential health disorders or diseases in people who are apparently healthy and do not have any symptoms of a disease. The goal of the screening is early detection of diseases so that they may and can be treated also early enough to avoid disability and death. Screening can be done only once, one time, meaning on a one-time basis. It may also be done repeatedly, as in periodically, every so often, the periodicity of which may be determined based on the risk factors of the patients, such as occupation, age, family history, etc. The recommendations of the organization is also another indication, and also the wish of the patients. The annual physical examination, or APE, that is popularly being used in workplaces and schools is an example of periodic screening. Other screening programs that are being done periodically are the so-called executive checkups and cancer screening packages. Executive checkup is a health screening program, originally or historically speaking, being done for executives or people with senior managerial responsibility in business organizations. The phrase is still very popular up to these days, even if the screening program has been extended to just anybody, the common tao, the common people in the community. Hospitals and clinics are still use the term executive checkup to market their health screening programs. There are different packages of screening executive checkup. Cancer screening packages are those screening programs being recommended by different medical organizations and government institutions intended for the early detection of different types of cancer. Examples are the screening packages for breast cancer, colorectal cancers, prostatic cancers, cervical cancers, etc. Periodic health check and periodic health examination are terms that have started to be commonly used in the medical world to refer to the periodic screening instead of the traditional executive checkups and annual physical examination. These terms encompasses all past and current screening health programs such as executive checkups, annual physical examinations, cancer screening program, etc. Except for the newborn screening program, in the Philippines, all existing screening programs are not mandated by law. Again, except for occupational, travel, and organizational requirements, subjecting oneself to a screening program is voluntary. I repeat, it is voluntary. There may be recommendations from the medical organizations and government health ministries and peddling by hospitals and clinics, but the decision rests on the individual persons. So it's voluntary. The phrase medical surveillance, how does it differ from the medical screening or screening? Screening can be up-leveled to medical surveillance, where the connotation is that there is a need for close monitoring with screening. Medical surveillance is usually done in the following situations. One, after something unusual is found on screening, there is a need to closely observe or monitor the findings found on initial screening in order to get to a more definite diagnosis. Second, after a definitive medical condition is found on the screening, there is a need to closely observe or monitor it, as it does not require an active treatment at the moment, or the so-called expectant management or watch and wait management. The third indication, it's that after a treatment of a definite medical condition or disease has been done, regardless of whether this medical condition or disease was found or screening or not, and there is a need to closely monitor and observe for persistence or recurrence of a medical condition or the disease. Example are the medical surveillance for cancer recurrence. After patients are being treated for cancer, there is a medical surveillance for cancer recurrence. How does WHO or World Health Organization define screening? In 1994, WHO defined screening as the use of presumptive methods to detect and recognize health risk or asymptomatic disease in apparently healthy individuals in order to permit prevention and timely intervention. Screening is performed to categorize members of the general public into those with higher or lower probability of disease, with the former group being urged to seek medical consultation or attention for definitive diagnosis and treatment. A question commonly asked, should I have periodic health check or periodic health examination? The answer can be yes or no after removing the legal newborn screening, occupational, travel, and organizational requirements. The answer is yes if you and your trusted physician have assessed that you, generally healthy, have a higher risk for developing a particular disease because of a strong family history. Some would use age as an indication. If there is a high incidence for a particular disease in a certain age group. If you should undergo screening, screen only for the identified disease at risk. The answer will be no if you and your trusted physician have assessed that you, generally healthy, do not have a higher risk for developing a particular disease as compared to the general population in your age group. Other reasons for no answers, studies have shown that general or routine health checks had not, I repeat, had not reduced morbidity and mortality, neither overall or for cardiovascular like stroke, okay, heart attack, okay, or cancer causes. So studies have shown that general routine screening have not reduced the morbidity and mortality. Okay? So the practical recommendation is to be selective using the risk-based approach. Other reasons for no, just like in curative medicine, the biggest pitfall in disease prevention, which is screening is a strategy, is that things that ought to work do not always do so. Even the strategy of screening has its failures. The presence of false positive results in screening tests has many asymptomatic patients wrongly labeled as being ill. So instead of improving the quality of life of people, this phenomenon of false labeling has been found to wreak havoc on the social, psychological, physical, and financial stability of the unfortunate individuals with false positive results. Furthermore, false positive results often lead to a battery of expensive and unnecessary follow-up procedures. The presence of false negative results can give a false assurance that everything is okay, which may lead to complacency, may lead to ignore or minimize new symptoms that may occur in the future. A lot of times, an ounce of prevention translates to just an ounce of cure. So if you don't go for periodic health checks or periodic health examinations, just make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. So with these strategies, you still have an opportunity to catch the disease early. So the answer to this question, should I have periodic health check? So not always, as there is another option of promoting early diagnosis aside from periodic health check, the so-called symptom-based early health check. I will discuss symptom-based early health check in the next session under early diagnosis and early treatment. For today, I will be focusing on screening and periodic health check. As I said, it is used for people who are asymptomatic, apparently healthy, who are screened for early detection of diseases so that they can be treated early enough to avoid disability and death. I will elaborate on the general methods, specific methods, tests, and utility. I may make comments on advantages and disadvantages. Let's start off with the myth. So myths are believed by many but are not true. So one myth is that screening and periodic health check must always be done with laboratory tests and x-rays. No, it's not true. They can be done without laboratory tests and x-rays, such as physical examination and risk assessment interview. So you can do screening with physical examination and risk assessment interview alone. The other myth is that screening and periodic health check done with laboratory tests and x-ray are always conclusive and are always more accurate than without tests. Again, it's not true, because there are also false positive and false negative with laboratory tests and x-rays. Thus, they are not always more accurate. The general screening methods commonly done in the Philippines and even elsewhere, okay, are the following. Okay. Without the use of gadgets, the other one is with the use of gadgets. Okay. So without the use of gadgets, you just rely on risk assessment interview and physical examination, or just physical examination. It's another screening method. Another screening method without the use of gadgets is just risk assessment interview without physical examination. And then those with the use of gadgets, you can combine this with risk assessment interview and physical examination, or without risk assessment interview and physical examination. So what is meant by gadgets? Gadgets includes instruments used on top of the inspection and palpation of physical examination of the physician, such as thermometer, the use of blood pressure apparatus, stethoscope, otoscope for the ear, nasopharyngoscope for the nose and the throat, ophthalmoscope for the eyes, endoscopy, blood examination, imaging procedures like ultrasound, X-ray, CT scan, MRI, nuclear scanning, etc. So when you say risk assessment interview, it just means asking the patient or the person to explore for possible presence of significant risk factors for a medical condition or disease. Physical examination means examination such as inspection or palpation of the body of the patient or person using the 5 senses of the physician without the use of gadgets. So in this particular method, without the use of gadget, just risk assessment and physical examination. Okay, so shown here are these 2 arrows here. Okay, and then for the without use of gadget, just physical examination. Okay, an example here is the annual PE in schools, which are commonly done. Okay, up to now, I suppose. Okay, but without lab tests, just physical examination by the school physician. Okay. Without the use of gadget, just risk assessment interview and no physical examination. This can be done, but not as effective as those with physical examination. An example, a typical example here, just screening for using the risk assessment interview. So you ask the patient, do you have history of contact in this age of pandemic, okay, with COVID-19 patients? If there is a high risk for COVID infection. Okay, the patient is most likely asymptomatic at the moment. So that's an example of the use of, without the use of gadget, just based on the interview. Now, comparing the 3, the effectiveness of these 3 methods, okay, the best will be that with risk assessment interview and physical examination, because the physical examination can explore and investigate risk assessed in an interview. Example, in a patient with risk assessment interview, one found that there is significant risk for breast cancer in this particular patient who is 50-year-old female. Okay, so if you add the physical examination to the screening, so the physician doing the physical examination will allot more time now and effort on the breast for possible breast cancer. Another example, risk assessment interview showing significant risk for stroke in a 60-year-old male. So when doing the physical examination by the physician, he will allot more time and effort on the neurologic examination, and also an examination of the heart, especially the heart rhythm, etc. So this is what is meant by among the three. If you don't use any gadget, no, doing risk assessment interview and physical examination is still the most effective. About with the use of gadgets, okay, with or without, two methods, with or without risk assessment interview and physical examination. Comparing the effectiveness of the two methods, again, risk assessment interview and physical examination with screening gadgets is better because findings on the interview and PE can be correlated with those on the gadgets to reduce the problems of false positive and false negative conclusions. And comparing the cost effectiveness of the two methods, gadgets with risk assessment interview and physical examination is better, as the latter will rationalize the use of former screening gadgets. Okay? That is done only when indicated as dictated by the findings on the risk assessment and physical examination. Examples of screening gadgets being used. As I said, thermometer will be used for temperature, blood pressure apparatus, blood pressure, weighing scale, the weight, stethoscope, heartbeat and breathing, otoscope, the ear, examining the ear, nasopharyngoscope, nose and throat, ophthalmoscope, eyes, blood examination, the blood contents, urine, the urine content, and then endoscopy. Any part of the body can be scoped, okay, by inserting a tube, okay. Imaging procedures, just like X-ray, nuclear scan, can also be done for any part of the body. So all of this can be done once or repeatedly as indicated. So example of use of thermometer, which is used to identify fever, okay. So screening for possible COVID-19 infection during this pandemic, if there is fever, then you suspect COVID-19 infection. But note here, there are false positive, as not all fevers are COVID-19. And there are also false negative, and because not all COVID-19 patients present with fever. Blood pressure apparatus, this is for screening for possible hypertension. If you have persistently elevated blood pressure above normal, then you are suspected to have, or you're diagnosed to have, hypertension. Weighing scale is also used as a screening tool, okay, to check whether a patient is underweight, overweight, and obese, or normal. Blood count, example of use of complete blood count is commonly used, okay, screening for blood disorders, okay. In this test, you may be able to detect anemia, leukemia, and thrombocytopenia. Some thrombocytopenia means there's a below normal count of platelets. Leukemia, there's a unusually high level of blood count on the white blood cells. Okay. So examples of urinalysis. Okay, urinalysis is used to screen for urinary infection and kidney diseases. Chest X-ray, screening for pulmonary tuberculosis. Diabetes, you can use risk assessment interview to check if there is a higher risk, okay, in the presence of family history of diabetes. Then you can also use the gadgets, fasting blood plasma glucose test, or FBS, or fasting blood sugar, or the so-called HG1AC. For hypercholesterolemia, you can use the interview and also the lipid profile, the lipid panel test. Okay. Now, screening method for breast cancer, aside from the interview, you can also do breast self-examination. This can be done by the patient himself or herself, and then the physician breast examination, and then mammography. Okay. Now, for colorectal cancer, some of the screening methods are mentioned here: risk assessment interview, rectal examination, fecal occult blood test, and colonoscopy. For prostatic cancer, risk assessment interview, rectal examination, PSA or prostatic surface antigen. cervical cancer, interview, pap smear, or HPV test, or human papillomavirus test. Okay. For lung cancer, aside from the interview, one can do a low dose CT scan or chest X-ray for screening. So there you are, screening and periodic health check. I have given you examples of screening methods using different approaches: risk assessment interview, physical examination, and the use of gadgets. Again, periodic health check just means the screening is done from time to time at certain intervals, regularly or not regularly, meaning as indicated, as needed. In this era of commercialism in medicine and healthcare, there are a lot of hospitals and laboratory clinics peddling screening gadgets, packages, okay, just like those shown on the right side of the screen. One should understand the indications, the pros and cons of screening and periodic health check. My advice is don't be swayed easily by the marketing and discount offers like those shown here. The most cost-effective indication is still to have screening and periodic health check if there is a high risk for a certain disease. The other indication is to do screening and periodic health check, especially when you have to use expensive gadgets, okay, if there is a good chance for a curative treatment once you discovered a disease. Another advice is to look at the scientific data on the cost effectiveness of screening and periodic health check. So I would advise these two good sources of information: the US or United States Preventive Service Task Force and the Canadian Task Force on Preventive Healthcare. So these are independent bodies. These are not being swayed by the monetary compensations of other factors. Okay, very independent. So let me just cite you some examples on the importance of the use of the scientific data, especially those who are very, very objective. Okay, no biases, no financial interest. Okay, so an example is the use of complete blood count, which is one of the most commonly abused blood tests, left and right. Okay, so the clinical questions being posed has been studied by the task forces. Is there evidence for screening with complete blood count in asymptomatic, those without symptoms, non-pregnant adults, specifying non-pregnant or any adults for that matter? Okay, so the bottom line, the answer here is neither CBC, complete blood count, nor its components should be ordered for screening asymptomatic, non-pregnant adults, as it does not reduce mortality. So up to 11% of the results are abnormal. Okay, but less than only out of this 11, only 1% of the results require management change. Okay. Another example of commonly abused screening tool is urinalysis, which is usually done left and right in all the clinics, in all the hospitals. Again, it is not recommended in pregnant women. Okay? So recommended by the USPSTF. For the lipid profile, those for cholesterol, triglycerides, etc. Okay, so the recommendation by the USPSTF in 2020. Okay, so let me just say that this has been commonly abused also. It's most of the time it's being done yearly. Okay, and then for all people. Okay, so here mentions are those people who are recommended for screening for the hypercholesterolemia. Okay, so screen men aged 35 and older for lipid disorders. For women aged 45 or older, and then make it every 5 years. Okay, not every year as is commonly done. Okay. Breast cancer screening, another example. Recommendations by the Canadian Task Force on Preventive Health. In women aged 40 to 49, mammography is not recommended. So what is being done in the Philippines is that almost everybody is undergoing mammography after age 40. Okay? In women aged 50 to 74, mammography every 2 to 3 years is recommended. Again, it's not yearly. If you have to do mammography for age 50 to 74, remember, up to only 74, not up to 80 or 90, okay? Mammography every 2 to 3 years. Okay? So the ultrasound, MRI, CT scan are not recommended for screening. Okay, let me repeat. In this era of commercialism in medicine and healthcare, where there are a lot of hospitals and laboratory clinics peddling screening packages, one should understand the indications, pros and cons of screening and periodic health check. Don't be sold, don't be swayed easily by the marketing and discount offers. So conclusion, takeaway, screening periodic health check is used for people who are asymptomatic, apparently healthy, who are screened for early detection of diseases so that they can be treated early enough to avoid disability and death. Should I have a periodic health check? As I said, the answer is yes and no. Yes, if you and your trusted physicians have assessed that you, generally healthy, have a higher risk for developing a particular disease because of a strong family history. If you should undergo a screening, then screen only for the identified disease at risk. No, if you and your trusted physician have assessed that you, generally healthy, do not have a higher risk for developing a particular disease as compared to the general population in your age group. If you don't go for periodic health check and periodic health examinations, make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. Symptom-based health check, early health check, means that at the onset of symptoms, the patient consults a physician right away for early diagnosis so that a discovered disease can be treated early enough to avoid disability and death. The symptom-based early health check also carries an opportunity to catch the disease early. So a thing that has to be emphasized also, if an early stage disease is diagnosed, whether from the periodic health check or from the symptom-based health check, this should be followed by early treatment to get results. And late treatment by the patient, for whatever reasons, which is commonly seen in our country, for whatever reason, financials and other reasons, or the patient just doesn't want to have treatment, okay, will negate the gain of early diagnosis. So with that, I end my pep talk. Okay. Staying healthy and contented, screening and periodic health check. I hope I have empowered you to have a better understanding of the use of screening and periodic health check as a strategy, as one of the strategies in staying healthy and contented. Okay. So as a reminder before we leave, take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate. I'd like to have make a shout out to these 5 persons who have so far completed all the requirements up to date up to now, inclusive of the homework, the project, advanced directive, intentional living plan, and healthy lifestyle plan. So shout out to Rochelle De La Cruz, Rex Mendoza, Tolentino, Mary Chris Sumalay, Nasesia, Beth Tumambing, and Christina Sara. Okay. So let's now have a group picture taking before we start the QA and interaction. Please turn on your video and show your face. Ready? Abol. 1, 1, 2, 3. Page 2, page 2. 1, 2, 3. Okay. So the floor is now open for questions, comments, okay, and any other sorts of kinds of interactions that you want to have with me, okay, or with